Hi, I'm Izzy.
And I'm Emily, and we're PNW nursing students, and today we're going to be talking to you about drug overdose prevention.
So first, what is an overdose? An overdose occurs when a toxic amount of a drug or a combination of drugs overwhelms the body, leading to life-threatening effects. However, this process is gradual, allowing time for intervention to prevent overdoses.
Alright, some commonly abused substances. Opioids are the leading cause of overdose deaths. These drugs work by relieving pain but also slow breathing, which makes them especially dangerous in high doses. Some of the most common opioids involved in overdoses include heroin, which is an illegal opioid that is highly addictive and often mixed with other substances, fentanyl, which is a synthetic opioid that is 50 to 100 times stronger than morphine. It is a major driver of overdose deaths. Methadone, which is a medication used for pain relief and an opioid addiction treatment. Morphine, a powerful pain reliever often prescribed for severe pain. Oxycodone, found in medications like oxytocin and Percocet, is frequently prescribed for pain but has a high potential for misuse. Both prescription and non-prescription pain relievers such as hydrocodone, tramadol, and illicitly made opioids also may contribute to overdose cases.
So risk factors. While anyone using opioids can experience an overdose, certain factors increase the risk. There are important considerations for clinicians and nurses when prescribing opioids. People 65 and older are more vulnerable due to changes in metabolism and an increased likelihood of taking multiple medications at the same time. People with a history of overdose or substance use disorder are at a higher risk as well. Conditions like sleep apnea or other breathing disorders make opioid use more dangerous because they suppress breathing. Taking a high opioid dosage, especially over 50 mmes per day, is also a risk. Returning to a high dose after a period of lost tolerance, which happens after tapering off opioids or being released from prison. Mixing opioids with other drugs such as Xanax or Valium significantly raise the risk of an overdose because both of them slow breathing. And people with kidney or liver failure may have difficulty processing opioids, leading to higher drug levels in the body. Understanding these risks can help healthcare providers and individuals make safer decisions about opioid use.
Next is the signs of an overdose. Opioid overdoses are one of the leading causes of injury-related deaths in the United States, but these deaths are preventable. The key to saving a life is recognizing the signs of an overdose and acting quickly. The first sign is unconsciousness or an inability to wake up even when shaken or spoken to. The person's heart rate may be abnormally slow. The person may not react when you try to talk to them or shake them. Watch for slow, shallow, or stopped breathing. You may also hear choking, gurgling, or snoring-like noises. These sounds indicate the person is struggling to breathe. Discolored skin, especially blue or pale lips, nails, or skin due to lack of oxygen. Check the person's pupils. In an opioid overdose, pupils become small, constricted, and do not respond to light, which is a classic sign of opioid toxicity. Recognize these signs early, and responding immediately can mean the difference between life and death.
So next are some statistics. So an estimated 2.2 million people in the United States have had an opioid use disorder, and less than 20% of them are currently receiving treatment. 1 in 12 Hoosiers are struggling with an addiction, and nationwide 44% of people felt like they needed treatment but did not seek help due to the fear of what people would think or say about them. More than 932,000 people have died since 1999 from a drug overdose.
Treatment and rehabilitation. Substance use disorder is a treatable condition. While it is a chronic disease that cannot be cured, people can live healthy and fulfilling lives in recovery with the right treatment and support. There are several types of evidence-based treatment programs, including inpatient treatment, which provides 24/7 medical care, outpatient treatment, where individuals receive therapy while maintaining daily responsibilities, residential treatment, offering structured long-term recovery support, and day treatment, which provides intensive therapy without overnight stays. One of the most effective methods for treating opioid addiction is medication-assisted treatment, or MAT. This combines counseling, cognitive behavioral therapy, and FDA-approved medications to help people manage cravings and withdrawal symptoms. The most important thing to remember is that help is available and it is never too early or too late to seek support.
So, long-term effects. Opioid overdoses slow or stop breathing, causing a lack of oxygen. Without oxygen, unconsciousness, brain damage, comas, and death can occur. A lack of oxygen can also cause long-term damage to the brain, the heart, the liver, and the kidneys. Stimulant overdoses like cocaine can lead to a heart attack, stroke, or high blood pressure, causing permanent heart issues. Some drugs increase seizures and cause peripheral neuropathy, and many overdose survivors experience worsened mental health conditions. Overdose survivors can also face guilt or strained relationships with family and friends due to being embarrassed.
Role of the nurse. Nurses play a crucial role in preventing opioid overdoses and supporting recovery. Our job goes beyond medical care. We are also educators, advocates, and resources for patients and their families. We should educate people on recognizing overdose signs such as unconsciousness, slowed breathing, and blue lips or nails. Early recognition can save lives. We should teach the importance of carrying naloxone or Narcan, a medication that can reverse an opioid overdose. Many people don't realize that naloxone is easy to use and can be a life-saving tool in an emergency. We should connect patients and families to the right resources such as rehab facilities, treatment programs, and crisis hotlines. Recovery is a journey, and access to the right support makes all the difference. By taking these steps, nurses help empower patients, reduce harm, and ultimately save lives.
So, ways to prevent an overdose. Preventing an overdose starts with making smart and safe choices when using medications. So, always use medications as prescribed, and do not take any higher doses than directed, because it can increase your risk of an overdose. Avoid mixing drugs, especially opioids and alcohol, because they slow breathing, and when combined, they can be deadly. It's important to know your tolerance. If someone stops using opioids for a while and then takes the same dose, their body may not be able to handle it, leading to an overdose. Never use opioids alone. Having someone nearby who can call for help can mean the difference between life and death. And then carry Narcan. This medication reverses an opioid overdose, and it's easy to use. Many states allow you to get it without a prescription.
Now we have a little video on how Narcan works in the body and how to use it.
There are 3 simple changes I tell all of my arthritis patients to make. Number 1, you have to start drinking more water. You wouldn't believe.
Opioids attach to receptors in the brain, sending signals that block pain and calm the body. Serious side effects include reduced heart rate, the inability to respond, or breathing may even stop, leading to brain damage or death if left untreated. Narcan nasal spray can save a life. When administered, naloxone molecules attach to opioid receptor sites in the brain. By displacing the opioid molecules, Narcan nasal spray can reverse the life-threatening side effects of an opioid emergency, specifically respiratory depression, allowing the person to breathe again. This generally takes 2 to 3 minutes to allow time for the medicine to work. It's important to call 911 immediately after giving the first dose. Consider keeping Narcan nasal spray in your first aid kit, and be ready for an unexpected opioid emergency. You have the power to save a life.
Alright, and then one thing about Narcan is that you can get it at CVS. It's over-the-counter medication, so anybody can get it, and it could help save a life.
So next, some overdose resources. So if you or someone you know needs immediate assistance, dial 211 to be connected to available providers. This service is available 24/7. 24/7. If you or someone you know is currently experiencing a substance use crisis, call 988 to reach the Suicide and Crisis Lifeline to speak with a trained crisis specialist 24/7. Treatment atlases also make finding addiction treatment easier by allowing individuals to search for specific programs that meet their specific needs, which is really cool. There are many addiction help groups and rehab clinics available in all parts of the U.S. to also help with those struggling. Thank you for listening.